Hi everybody. We are now going to move on into the autocoids and antihistamines. So let me hit play here. Autocoids occur naturally in the body. They're produced by a lot of tissues and are formed by tissues on which they act. Okay? They have a local short life and they don't travel through the blood. So that's what makes them different from hormones. Okay? Histamine is in all tissues, or all tissues can synthesize histamine. And in the human body, it is stored in the mast cells that are in the intestinal mucosa and in the CNS. It's released from the tissues of the body by normal reactions, abnormal reactions, and administration of certain drugs. The amount of histamine released in these reactions determines the effects seen in the patient. Pharmacologic effects of histamine. When there is an antigen or antibody reaction, the mast cells break apart and release this histamine into the bloodstream. The H1 and H2 are histamine receptors. The H1 agonist affects vasodilation, increased capillary permeability, bronchoconstriction, pain or itching in cutaneous nerve endings. And then the H2 are the gastric acid secretions. They increase the gastric acid secretion. Adverse reactions. The most serious adverse reaction is anaphylaxis, and it is serious, sometimes fatal reaction to foreign proteins. Symptoms of this include difficulty in breathing, convulsions, unconsciousness, and even death. Bronchoconstriction is the predominant feature, where people have difficulty breathing. Decreased blood pressure followed by shock and cardiovascular collapse. Epinephrine is what's used to reverse the anaphylactic reaction. Agents that block histamine. H1 blockers or H1 receptor antagonists, that is the H1RA. Capillary permeability, less tissue edema, this is what they cause. Vascular smooth muscle, they block the dilation. Non-vascular bronchial smooth muscle, so bronchial dilation, so if their airway is constricted, it's now going to open it up. Nerve endings, it suppresses the itching. So you can imagine what some of these drugs are, and we discussed some of them in class, but things such as Benadryl can help with this. The H2 blockers, or the H2 receptor antagonists, the H2RA, decrease GI fluids. So let's talk about the H1 blockers, or the H1 receptor antagonists. The first generation of antihistamines. These drugs include Benadryl, Dramamine, Unisom, Dimetapp, chlortrimetol, and diphenhydramine. The uses are to control allergic rhinitis, so that's the allergies in your nose, of course, seasonal hay fever, nausea and vomiting, that's the Dramamine, with motion sickness, the pre-op sedation, so pre-surgery sedation. They can be used as a sleep aid. They can be used as local anesthetic. And antihistamines are used in cold medications but are not useful in the treatment of the cold, just the symptoms. And what makes you choose one over the other? There are some that have more side effects than others. Some make you really, really drowsy, but help with the reaction, and then some just help you with motion sickness and allergic reaction. but generally you would use like a Benadryl for allergic reaction and Dramamine for motion sickness. Diphenhydramine is the main ingredient in Benadryl. And then Unisom is primarily works with, is a sleep aid for the most part and for colds. Same with Dimetap and chlorotrimetol. I'm not sure exactly what the best thing for that is, but I believe it's just for colds, primarily to relieve the symptoms of them. So H1 blockers or H1 receptor antagonists. Adverse reactions, of course, sedation is the most common, drowsiness, confusion, xerostomia, blurred vision, constipation because it's reducing that GI fluid, tachycardia, so increased heart rate, nausea, and vomiting. So some of them are used to prevent nausea and vomiting, and then some of them can actually cause the adverse reaction. Dental considerations, of course, we're always concerned about xerostomia, so things we want to recommend is that they drink water, they stay away from sugary foods and juices and soda, chew sugarless gum. And then nitrous oxide, of course, we don't want to use that if their nose is plugged. They aren't going to get the benefits of it. So the second generation are great because they don't sedate you as much. So you can take them throughout the day or in the morning and not fall asleep at work. So here we're looking at Claritin, Allegra, Zyrtec. Again, I believe now all three of these are now over the counter. And Hismanol, which is not on the market. Not really sure why that's even on here. Less side effects is the benefit. Again, non-sedating, does not cross the blood-brain barrier, and that's why it's not sedated. So know that for your test, that it's not sedated, it's non-sedating because it doesn't cross the blood-brain barrier. These also don't cause xerostomia. And when you're taking the Seldane and the Hismanol, no erythromycin. Again, erythromycin is the antibiotic that has the most drug interactions. The H2 blockers or H2 receptor antagonists. Drug is Tegament. Its use is to treat GI problems. Contraindications or extreme caution with COPD and asthma. Persons operating machinery or driving a car, elderly patients, cardiovascular disorders, benign prostatic hypertrophy, infants, pregnancy, and lactation. Other autocoids act on prostaglandin, or the other autocoids are prostaglandins and thromboxanes. Prostaglandins, they have smooth muscle effects, GI effects, uterine contractions, okay, and platelets, and they can increase the body temperature. So know the prostaglandins are an autocoid. They cause uterine contractions. They also affect platelets and clotting, and they're beginning to really think that they play a big role in periodontal disease, but I don't know how far they've come with that, to be honest with you. Oh, here's a slide on it. They are found in at least 2 of the stages of periodontal disease, the inflammation and the resorption of the alveolar bone. Prostaglandins can prevent osteoblastic activity, and they're used to induce abortions. Prostaglandins can be used to treat stomach ulcers. And nonsteroidal anti-inflammatory drugs are being explored for the management of periodontal disease because of the prostaglandins. All right, so that sums up the autocoids and antihistamines. And, you know, pretty straightforward. I think we're all pretty familiar with especially the antihistamines. So, all right, take care.